doing?
Good, how are you?
Good. My name's Valerie, and I'm going to be your nurse today.
Okay.
So I've identified myself to my patient, and I'm going to wash my hands before I touch her. I'm just here to do a set of vital signs with you. Is that okay?
Mm-hmm.
Okay, so I've explained my procedure to my patient. I'm going to close the door for privacy, and then I need to identify my patient with 2 patient identifiers, so name and date of birth as well. Can you tell me your first and last name?
Ashley Huddleston,
Okay, and what is your birthday?
4488.
Okay, and that's right. Do you have any allergies that you know of?
Shellfish.
Shellfish, okay. Alrighty, so if I did have anything that had iodine in it, I would be aware of that, but I don't. So first, what I'm gonna do is get her blood pressure. So before I start measuring my cuff and putting it on my patient, I need to observe her upper extremities, and I'm gonna ask her some questions about specifics if I should be able to do blood pressures on either arm. So I'm gonna look at the arm and the skin integrity. I wanna know any type of edema, wounds, trauma, scarring, which I do not see. And I don't see any IV sites or central lines. Have you ever had a stroke or anything that has affected one side or the other?
No.
No, okay. And have you had any type of breast or lymph node surgery on either side?
No.
No. And no dialysis fistulas that I can see?
No.
Okay. So is it okay if I do your left arm?
Yeah.
All right. I'm gonna raise the bed up, and I want my patient in either a sitting or a semi-lying position, and I want her in that position for at least 3 minutes before I start my blood pressure. So I need to measure my cuff to make sure that I have the appropriate size cuff for my patient. So the first thing that I want to look at is the width of the cuff. It needs to meet at least 40% of her arm between her elbow and her shoulder. So I'm looking at this covering about half of her upper arm. So starting at her elbow to about her shoulder right there, so that looks like it's an appropriate size. And then her arm should be 80%, within 80% the circumference of the bladder of the blood pressure cuff. So I have a range value, and then I have an index marker here. What I'm looking for is to have this index marker in between my 2 range values once I wrap the cuff around her arm. And so once I've done that, that index marker is pretty much right in between those 2, so this is an appropriate sized cuff. Before I actually put it on my patient, I need to identify her brachial artery. So I'm gonna have her extend her arm. I'm looking at the bend of the elbow here, and usually the brachial artery is a little bit more medial to the side of the arm here. Okay, so I've marked it at about right there. When I'm placing my cuff, I have a little tag here that says left arm, right arm. So I'm working on her left arm. I'm gonna put this arrow directly over where I palpated her brachial artery. I wanna leave about an inch space in between where I palpated that artery at and my blood pressure cuff, so there's no interference. And I wanna be able to visualize my manometer or my gauge without any issue. So before I start pumping my cuff up, can you tell me what you think your baseline is for your blood pressure?
120 over 70-ish.
Okay, so I'm gonna go off of her systolic baseline, which is 120. I'm gonna pump the cuff up at least 20 to 30 millimeters of mercury higher than what that baseline is. If you look at your manometer here, each of these hash marks, the big bold hash marks equal 10 millimeters of mercury, and the little small hash marks equal 2 millimeters of mercury. So I'm gonna take my stethoscope, and I'm gonna place the diaphragm side of my stethoscope directly over where I palpated that brachial artery. I'm going to grab my valve. I'm gonna twist this valve all the way to the right to close it off. And I'm gonna slowly inflate my cuff until I get to about 140, 150. I'm gonna slowly release to the left. Okay, I got 132 over 82. So what I'm listening for there, whenever I start to release my valve to the left, I wanna let that needle fall about 2 to 3 millimeters of mercury per second. The very first sound that I hear is gonna be her systolic pressure, or the top number. I'm gonna keep listening for pulsations until I no longer hear one. The very last pulsation that I hear is going to be her diastolic number, which is the bottom number. After I've heard that last sound, I'm still going to listen for another 10 to 20 millimeters of mercury just to make sure that I haven't missed any her bottom number any lower than that.